Preparation. Each HbA1c kit contains HbA1c test card and a foil pouch, also available sample diluents and instruction for use. To perform the test, you also need HbA1c, disposable capillary tubes, 10 microliter and 80 microliter, sterile lancet, alcohol pad, biohazard waste container, disposable gloves and timing device. Test procedure. Read the instruction for use carefully before testing. Open the foil pouch and remove the test card. Insert the test card horizontally into the slot of the immunoanalyzer. Caution, please insert the card in right position. Click Standard on WIZ-A101 home page. Please do the QC scan when you use new batch of kit. Make sure the test item and batch number are correct. Click QC Scan to scan the calibration QR code of the kit. Finger stick collection. Massage the finger with a downward motion several times before performing the finger stick. Clean the finger of person being tested with an alcohol wipe. Allow the finger to dry thoroughly or wipe dry. Using the sterile lancet. Punching the skin just on the center of the finger pad. And wipe away the first drop with an alcohol pad. Collecting the second drop of blood by holding the capillary tube inclined. Touch the tip of capillary tube to the blood sample. The capillary tube will automatically filling 10 microliter blood. Do not squeeze the bulb while sampling. Sample pyrolysis. Transfer all the blood to diluent by blocking the small hole at the top and gently squeezing the bulb. Cover the centrifuge tube, turn it upside down manually, and mix thoroughly for 1 minute. Sample loading. Taking out a 80 microliter capillary tube. Squeezing the bulb of the capillary tube. Insert the tip of capillary tube to mixed solution. And gently release the bulb to fill the capillary tube. Until the flow of blood has reached the top. Expel all that contains to the reagent sample hole by gently squeezing the bulb. After adding sample, click Timing. The analyzer will automatically timing. When time's up, the result will appear on the screen within 10 seconds.